Today I'd like to speak to you about the challenges and the opportunities in aligning funding mechanisms for acute and post-acute care. Now, the main issue driving this is that currently funding policies for acute and post-acute care are not aligned to achieve efficient patient flow. And by that, we can see evident in poor patient transitions, in terms of hospital readmissions, and more particularly in terms of alternative levels of care, or ALC patients, which have been observed across provinces. Colloquially, those are referred to as bed blockers. That is, those patients who have been formally discharged before whom there is no discharge location. Specific to acute hospitals, historically they've been funded through global budgets. This, however, creates disincentives around discharging patients to post-acute care facilities and increasing their volumes. And by this I mean that they would be exchanging relatively low-cost patients for relatively high-cost patients. There's also no incentives for improving quality or efficiency. Speaking in terms of post-acute care, those have been historically funded through global budgets and capitation. And I should clarify here, by post-acute care, I'm referring to things like inpatient rehab, long-term care, and home care. Here again, we see there's disincentives for these facilities to take on more complex patients, and very few rewards for positive outcomes. So one proposed option being considered is blending activity-based funding, or as I'll refer to as ABF, with global budgets for funding acute and post-acute care across to improve this patient flow. ABF remunerates facilities based on the volume of services and on the characteristics of the patient. Patients are assigned to unique groups based on their clinical and demographic information, and each group is associated with a predetermined funding amount based upon their expected resource use. Now, because each patient generates revenue, ABF generally creates incentives around promoting volume and efficiency. So when we're talking specifically about hospitals, ABF has been shown to increase volumes, decrease lengths of stay, perhaps lower mortality, and however, it also is associated with increasing overall spending, which comes from an increase in activity. Speaking specifically about post-acute care, when we're talking about rehab, ABF has reduced the per episode cost and lowered length of stay. Long-term care, we've seen a lowered per incident cost, and there have been some evidence that for specifically targeted performance measures, there's been an improvement in those. And there is no evidence when we're talking about home care. Now, when we're talking specifically about the transition between acute and post-acute facilities, again, there is no evidence to support activity-based funding as having any improvement in this transition. So some of the challenges, well, with regards to hospitals, the ABF initiatives that are being taken across several provinces in Canada may be moot if there is no post-acute care locations available. That is, we will see an increase in ALC, or in the bed blockers. Policymakers also have to be prepared for an increase in costs because of the increase in activity, and they must adjust their budgets accordingly. For post-acute care, the challenges are timely and reliable data. Currently, which are needed for setting prices accurately. Currently, to give you an example, only Ontario requires that the rehab facilities submit data to the NRRS, the National Rehab Reporting System, managed by iHEA. There's also some evidence coming out of the US to suggest that public and private facilities, which is a phenomenon in post-acute care in Canada, react differently to ABF initiatives. And it's also unclear if in Canada, particularly in some rural provinces, that there's even the physical capacity that we would see any benefit arising from promoting volume and more efficient patient flow. And obviously the transition between facilities is a lack of understanding in terms of the implications and consequences for that. So to reiterate, the transitions between acute and post-acute facilities is a growing issue across Canada. And by that I mean ALC utilization is rising in many provinces. A complementary post-acute funding initiative is definitely needed, but whether or not ABF is that initiative is unknown. However, an initiative is needed, and it should encourage coordinated care and shared accountability for patient outcomes across these facilities. Thank you, and for more information, I encourage you to go to hospitalfunding.ca.